Good evening, class.
Good evening, Doctor.
Good evening, Prof. Good evening, sir.
You are welcome to this makeup lecture, service delivery. Service delivery is one of the key components of any health system. We said that it is one of the building blocks, the 6 building blocks of any health system by WHO. Service delivery is actually the first. Health systems are set up to deliver service to people, to individuals, to families, to communities. So service delivery is the very first component of health system. It's followed by health workforce. Without manpower, health professionals, nobody can deliver healthcare service. And that's followed by financing. Without money, you cannot provide service. You need to buy equipment, you need to buy drugs and consumables, you need to maintain the structure, you need to pay the health workers' wages. So financing is important. Then we'll talk about medicines, vaccines, and technologies. When you go to the hospital, after being seen, they will prescribe drugs for you. So that's a very important component. In fact, from the household point of view, when drugs are available in the hospital, it is seen as healthcare of good quality. Then we'll talk about health information management. The health information management system provides timely information for decision making. And then lastly, we have leadership and governance. The health system, the orthodox health system, is highly regulated. Training institutions are regulated, practices are regulated, equipment use are regulated, drugs are regulated. So leadership and governance provide that regulatory framework and also gives direction for services to be delivered. Today, we want to look at service delivery, the different forms service can be delivered. So this is the outline. Introduction, common health care delivery models, emerging trends in healthcare delivery. We look at primary healthcare, secondary healthcare, tertiary healthcare. And then for us to have effectively functioning primary, secondary, and tertiary healthcare systems, there must be referral system. Cases must be referred from primary to secondary and back to secondary to tertiary and back to secondary. Then we look at the orthodox healthcare system where you and I belong, where you and I practice. Then we look at faith-based care that our churches and mosques provide, our religious bodies provide. And then we look at traditional medicine and also look at complementary and alternative medicine. Any treatment that we combine with orthodox medicine is complementary. Any treatment we take and abandon orthodox medicine is alternative medicine. In other words, faith-based alone is alternative medicine. Traditional medicine alone is alternative medicine. But if we combine any of these things with orthodox medicine, it's complementary medicine. Are you there, class?
Yes, Prof.
Yes, sir.
Yes, Doctor.
Yes,
sir.
Yes, sir.
Yes, sir.
So let's start. We are looking at service delivery. So delivering services is one of the core functions of any health system. And like I said in the earlier preamble, that it is influenced by governance, it is influenced by financing and resource generation. So when we deliver service, it has a direct impact on the health system objectives. And overall, it leads to the achievement of health system goals. So, and we have defined health care delivery system severally as all the people, institutions, and services that contribute to coordination, patient flow, diagnosis, disease management, and health maintenance programs. So if we have a good health service delivery system, that will be very vital as an element of any healthcare system. Because we have said service delivery is one of the 6 building blocks of any health system. And it is a fundamental input in the maintenance of population health status. So service delivery, along with other factors, are important as determinants of health of populations. So different countries operate different service delivery formats. But every country, irrespective of whether you are developed or developing or underdeveloped, they have organizations in place to deliver service. However, the content of those health services will differ from country to country. But if that organization is functioning well, there are key characteristics which that health system should have. And what are those key characteristics? That it should provide comprehensive services. Comprehensiveness of service is one of the key characteristics of any well-functioning health system. What do we mean by comprehensive service? You should have a range of services that cover the entire spectrum, starting from promotive care to preventive care, curative, rehabilitative, and palliative care, so that whatever services people require, they can get it. The second one is that the services provided should be accessible. If the services are not accessible, then there are disparities. And that is the key issue, accessibility in universal health coverage. Services are directly and permanently accessible without undue barriers. Barriers caused by cost, caused by language, culture, or geography. These services should be accessible by geography. In other words, the health facilities should not be too far from where the people live. They should be as close to the people with a routine point of entry and to the service at primary healthcare level.
Hello, I'm not hearing anything. I don't know if it's from my end or it's from Prof's end.
I think it's from his side. I can't hear anything either.
From me, I can't hear.
His screen is gone.
Maybe it's from his end. The network self have locked from Prof out.
Yeah, just like it happened the last time.
Come, please, you have locked my video, so please, host, whoever the host is, please. I can't start my, they say you have disabled my video.
Yes, sir. So you are now the co-host. Go ahead, sir.
All right. My network went off. So, all right, let me reshare. So can you hear me? Sorry, I was locked out.
Yes, sir, we can
So
hear
we
you.
are looking at the characteristics of a good healthcare delivery system. And the first one we said is comprehensiveness. We have talked about accessibility. We've talked about coverage. That service delivery is designed so that all people in a defined location are covered, whether you are sick or you want to maintain your health, whether you are rich or you are poor, irrespective of your class. Then continuity. The service delivery should be organized to provide an individual with continuity of care across network of services. In other words, if you go to a primary health center, you are seen and your problem cannot be solved there. If they refer you to a secondary center, by the time they finish with you, you should be returned to the primary center so that they can continue with the follow-up and whatever. So, irrespective of the health condition, then the level of care, and over a life cycle, there should be continuity. Another one is quality. The services provided should be of high quality. That is, they should be effective. They should not harm the people that are receiving the care. And they should be centered around the needs of the clients or patients. And that health services should be provided promptly without undue delay. That is healthcare of good quality. And then another quality characteristic of healthcare delivery system is patient-centeredness. In other words, you see the patient as the focus of that clinical encounter, not the disease the person is suffering from or that health problem the person came with. So services are organized around the person, not the disease or the financing, if it is a profit-making organization. Users perceive health services to be responsive and acceptable to them. Responsiveness is a key thing. It's one of the health system goals. Responsiveness means meeting the legitimate non-healthcare needs of the patients. And then acceptable to them. That is, the health service should be acceptable to them. And in that case, for patient-centered care, there is participation from the target population in service delivery that are designed and assessed. People are partners in their own healthcare. So another characteristic is coordination. Local area health service networks are actively coordinated across types of providers. In other words, if one type of provider does not have comprehensive service, should have link to other people who provide other services so that they could provide coordinated care. So the patient's primary care provider facilitates the route through which the needed services and works in collaboration with other levels and types of provider. You might not have all the services, but you should be able to know and be in contact with people who have other forms of services that your patients might need. So you should be the through which they get those services. Coordination also takes place with other sectors, for example, social services, and then partners, that's community organizations. Then we have accountability and efficiency. If we don't provide healthcare services in an efficient manner, we are going to waste resources. And whatever services we are providing, we should be accountable to somebody. And that is where one of the building blocks is leadership and governance. Health services are well managed so as to achieve core elements described in the minimum wage, in the different characteristics we have described, with a minimum wastage of resources. That is the efficiency. Managers are allocated necessary authority to achieve planned objectives and help, and they are held accountable for overall performance and results. If you don't do well, you are responsible. If you do well, you are responsible. So that is it. Any questions, class? So let us look at some models of healthcare delivery. Some models of healthcare. There are different healthcare delivery models. And these models are organized, financed, and delivered with a focus on improving the outcome of patients and efficiency. In the Nigerian context, the social health insurance scheme uses health maintenance organizations. In other words, everybody who is registered under the National Health Insurance Scheme goes through a health maintenance organization. And then that health maintenance organization has a set of providers that are registered with the person. That's in the Nigerian context. So you choose, and then you go and you receive care. So the health maintenance organization requires members to choose a primary care physician and get referrals for specialists. So the health maintenance organization function emphasizes preventive care and typically has lower out-of-pocket costs for members. Another model is preferred provider organization. This model offers more flexibility in choosing healthcare providers and does not require referrals to see specialists. In other words, most of the private hospitals in Nigeria operate under this scheme. So when you go there, you receive primary care, you receive secondary care, you receive tertiary care in the same place. If the person is not there, they bring the person to come and give you care. So offers more flexibility in choosing healthcare providers and does not require referrals to see specialists. Members can see out-of-network providers at a higher cost because you are there. They will bring them in. So they will gain from bringing in the specialists to see you there. And then the specialists that are coming will also be paid. So another one is value-based care. We'll look at it later. It focuses on delivering high-quality care while controlling cost. Here, providers are reimbursed based on the results of the patients they care for, rather than the number of cases they see. This model, value-based care, encourages preventive care and better care coordination. Another common delivery model is integrated care model. This model aims to provide coordinated care across different services and providers. In other words, dental, eye, ENT, and so on and so on, enhancing the patient experience and improving health outcomes. It's particularly beneficial for patients with chronic conditions requiring multiple services. So another word is accountable care organizations. Here, the providers that come together, here, a group of providers, different providers come together to provide coordinated care to their patients. The aim is to improve quality and reduce costs by ensuring that patients receive right care at the right time. In other words, it's like a group practice. So different service providers are within the same organization. So whichever one you need is provided for you. So let us look at emerging trends in healthcare delivery. I told you we are going to look more about the value-based care. Telemedicine and virtual care. It came into being limelight during the COVID-19 because of lockdown, restriction of movement. It has become acceptable in care delivery. So telemedicine and virtual care models have gained popularity, especially during the COVID-19 pandemic. It allows patients to receive care remotely. Otherwise, you can be in Kafanchan and receive care from somebody in Lagos. And by so doing, it increases accessibility. You don't need to travel down, and it's convenient, provided you have the structure in place. That's an ICT network, so that you can communicate with the person at the other end. And if it's more elaborate, you can even see through a screen the person who is giving the directive and the person who is receiving the care. The patient said that medical homes. So this is another name for this one is advanced primary care model. It focuses on transforming primary care practices into patient-centered, comprehensive and coordinated care centers. This model emphasizes that care and coordination should transform primary care into what patients want it to be. It focuses on comprehensive care and long-term relationship between patients and the healthcare system. It emphasizes preventive care, care coordination, patient engagement, and enhanced access. So it's all about redesigning the workflow, implementing electronic health records, establishing care teams that include doctors, nurses, coordinators, and other allied health professionals to provide care. All right. Another one is collaborative care model. Collaboration means people coming together to work together. They involve team-based approach to healthcare, integrating primary healthcare with mental health care. to improve overall patient outcome. The model emphasizes a team-based approach to care, bringing together mental health specialists, primary care providers, and care managers so that they can address both physical and mental health needs. So under this model care, patients receive comprehensive and coordinated care. That leads to better outcome. I call you in 2 hours' time. I'm using the phone for lecture. To talk more about it. Are you hearing me, class?
Yes,
Yes,
bro.
sir.
Yes, sir.
Yes,
Yes,
prof.
sir.
Yes, sir.
We are going to talk more about it. So,
Yes, sir.
value-based healthcare fundamentally is a model that has the ability to collect relevant data and measure standard outcomes. Progress in this area has been slow due to closed system as well as issues related to interoperability. But it requires advances in technology, IT capabilities that allow data to be collected from across treatment pathways that will help overcome barriers that are in the system. So many healthcare systems indeed are moving away from the traditional fee-for-service model towards value-based model that delivers meaningful outcome for patients, as well as making sure that unnecessary costs and waste within the system are reduced. So if we have questions, if not, we'll go to another scope item, which is primary care, which all of us are familiar with. All of us are familiar with primary care. Primary care is the first level of care that we receive. So if you go to a primary health center for a headache and dizziness, it's primary care. If you go to a general hospital for a headache and dizziness without being referred, it's primary care. If you go to a teaching hospital for the same thing without being referred, it's primary care. So the World Health Organization defined primary health care as a whole of society approach to health and well-being. And this approach is centered on the needs and preferences of the individuals, the families, and the communities. Let us put at the back of our minds the alma mater definition of primary health care. We'll get there. So it addresses the broader determinants of health and focuses on comprehensive and interrelated aspects of physical, mental, and social health and well-being. That is the WHO definition of health. So the primary health care provides whole person care, in other words, the totality of the people for health needs throughout their lifespan. It's not just a set of specific diseases. So that's why if you look at the range, it's much more than one disease. Promotive care is there, preventive care is there, curative is there, so on and so on. So primary health care ensures that people receive comprehensive care that has the full range from promotion, prevention, rehabilitation, and palliative care. And this care should be in their environment, as close as feasible to people's everyday environment. So the concept of primary health care is rooted in a commitment to social justice. In other words, everybody, nobody should be alienated in getting this type of care. And equity. Equity means fairness and the recognition of the fundamental rights to the highest obtainable standard of health. In other words, everybody should aspire to have the highest standard of health as a fundamental human right. So everyone has a right to a standard of living that is adequate for health and well-being for himself, the family, including what you eat, what you wear, where you live, and medical care and social services where necessary. So it has been defined and reinterpreted in so many ways. In some contexts, it is referred to as a provision of ambulatory offline first level care to people. In some other contexts, it's understood as a set of priority health interventions for low-income populations. In those such situations, they call it selective primary health care. But like I said the other day, what we consider secondary care in Nigeria or even tertiary care might be primary care, health care in advanced countries like Europe and in Europe and America. Because like I said, access to CT scan, MRI, is part of primary care in Europe and America. So here, you cannot get it unless you get it through tertiary. So primary physicians in this area cannot order for such. They would rather refer you to higher level where they now think that is needed to get those things. But in Europe, primary physician can send you for CT scan and you bring the result and use it to guide yourself. So others have understood primary care as an essential component of human development, focusing on economic, social, and political aspects. So let us look at the Alma Ata Declaration definition of primary care, as well as the WHO definition of primary based on 3 key components. So by the Alma Ata Declaration, primary care is essential health care that is based on practical, scientifically sound, and socially acceptable methods and technology. The primary care should be made universally accessible to people, individuals, families, in the communities where they are, and through means that are acceptable to them, and that they should have their full participation in the provision of this care, and that the cost of care should be such that the community members and the country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. And finally, Alma Ata Declaration definition says that the primary care it forms an integral part of the country's health system, of which it is the central function and the main focus. And of the overall social and economic development of that community. So we have said this over and over. Even in our last lecture, we talked about it when we were talking about appropriate technology.